Welcome everyone to today's webinar, Realizing the Value of Enterprise Imaging, 5 Key Strategies for Success. I'm Emily Rapley with Becker's Hospital Review. We will begin the webinar today with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. Today's session is being recorded and will be available after the event. To access the recording, please use the same link you used to log in to today's webinar. At this time, it is now my pleasure to start today's webinar by introducing our presenter. Indra Lalari is a member of Change Healthcare's Enterprise Imaging Cloud Solutions team and currently serves as the Director of Product Management and Clinical Experiences. Ms. Lalari comes with close to 20 years of experience in the medical imaging industry, specifically leading the delivery of diagnostic radiology packs, women's health, and enterprise imaging workflow solutions in the U.S. and international markets. In her current role, Ms. Lalari leads the product management team delivering next-generation clinical and diagnostic image viewing experiences, which serve the image visualization needs of the full healthcare enterprise. This includes delivering a cloud-native enterprise imaging solution as a service. At this time, I am pleased to turn the floor over to Indra to begin today's presentation.
Thank you very much, Emily, for the introduction. Hello, everyone, and welcome to the session today, Realizing the Value of Enterprise Imaging. We're going to dive into how an effective enterprise imaging strategy can impact the outcomes that matter to your C-suite. We will also spend some time discussing the challenges the clinical care team is experiencing in an enterprise imaging environment and how to improve their satisfaction and patient outcomes. So let's get started. So looking at who we are, for those of you who are not aware of Change Healthcare, previously McKesson, just so you know where we're coming from and why we are experts in what we are presenting today. We have a large install base with a presence in 1 in 4 U.S. hospitals today. The primary market segments that we are in is the medium to large IDNs and have a significant experience with system-wide healthcare. Our company is recognized as a leader in the market for radiology, cardiology, enterprise imaging. We have innovative workflow orchestration solutions that directly impact outcomes that matter to healthcare organizations, and we provide infrastructure services as well. We've been in the industry for a long time, specifically in diagnostic imaging and enterprise imaging for more than 25 years. Healthcare is so complex, and our focus and dedication has been on solving healthcare providers' real problems through a level of understanding of their unique needs. And as a result, we've won many awards that recognize our contributions to the healthcare and the medical imaging industry. By first looking at what is happening in the industry and why enterprise imaging has come to the forefront. First, there is a big shift in focus on outcomes in the industry. The business of imaging is changing, and what we mean by this is value-based healthcare has been transforming medicine and thereby imaging as well. So providers are seeking ways to be more clinically effective while decreasing costs. They're looking to improve outcomes, and it's not just about improving outcomes with one system in place, but how can the data that lives in the enterprise be better leveraged such that they can make better decisions and ultimately make an impact on outcomes. And you will see how an enterprise imaging strategy can help you achieve those things. The next thing that's really driven enterprise imaging is EHR adoption. It is the bridge between the departmental silos. EHR is really the first health IT system that has been elevated up to the C-suite and became a system-wide approach to IT. Up until now, imaging has been departmentally driven, sometimes facility driven, and this has led to a fragmented system. So EHR adoption has really raised the awareness and strategic IT investments in the healthcare system. And now similar system-wide strategies are being sought after in imaging. And the third biggest thing that we see impacting enterprise imaging is the accumulation of data. Healthcare facilities are struggling with all these different islands of imaging data and information, securing them, managing of the lowest possible cost for getting rid of that redundancy that is in the system, and most importantly, making the data more accessible to the clinical care team such that it is faster, smart, and convenient to access. Because of these three challenges, we see enterprise imaging as a set of solutions that unify the management and access and analysis of clinical images across two verticals. One being able to span an imaging specialty like radiology and cardiology across the entire IDN so that you have a single system that can drive productivity and improve things like patient length of stay, turnaround times, and other metrics. And then not only limiting it to scaling across a single vertical, but horizontally as well across different types of imaging. So again, trying to aggregate your IT resources and your electronic health record down to a single point, aggregating radiology, cardiology, things like medical photography, point-of-care ultrasound, and other imaging specialties. And we believe a sound enterprise imaging strategy will absolutely improve your financial, clinical, and operational outcomes. And some examples of those that we can directly impact are population health initiatives. Connection between the different types of imaging and how that is going to play an important role for artificial intelligence analysis. One of the benefits of artificial intelligence will be the ability to leverage your existing data to run various population health studies. It would be very difficult to do that if you have multiple data islands. Physician satisfaction. Physician satisfaction is an important and crucial metric to today's C-suite because many physicians, as you know, are overworked, they have poor IT experience, they have difficulty accessing information, but we also see that enterprise imaging solutions can impact critical clinical drivers in a hospital like patient length of stay and patient throughput. And we'll walk through some of those examples as we go through the presentation. Financially, there's a lot of opportunity for an enterprise imaging strategy to improve your return on assets because there is so much redundancy in imaging IT infrastructure in most healthcare institutions today. EI strategies can help here. Next, labor utilization. This is an important cost, and in many cases, we aren't utilizing our talent effectively, and there are ways that we can optimize workflow and optimize the systems that they interact with to improve their productivity. Very important to financial for many health systems is their return on their electronic health record investment. We see over and over again that physicians just aren't happy with their EHR experience, and a lot of money is invested in that platform. We see the value of enterprise imaging as actually being part of that electronic health record, helping build a more comprehensive health record, and that it can be done in such a way that it actually empowers your physicians and helps improve the perception and the return and value on that investment. Then operationally, what we see is in the long term is that most health systems, the leaders as we talk to the CIOs, they do not want to be in the IT infrastructure business long term. And when you look at medical imaging IT, it is IT intensive and it tends to be deployed on premise, tends to be deployed with many complex different systems that are integrated with each other and often poorly integrated and introduces a lot of complexity when managing them. You have a lot of different systems, you have to put in high availability solutions and to make sure your data is secure. Prevent cybersecurity threats and so on and so forth. This is also a massive challenge for many organizations. Because of these complex environments we just talked about, medical imaging data has become a liability. Traditionally, imaging has been driven from the department, and it is through these traditional imaging IT strategies that have contributed to challenges in the health IT system. Departmental approaches have resulted in a fragmented health IT environment, and this has been the result of many things such as mergers and acquisitions. There is considerable provider consolidation that is taking place in the market, and this leads to acquiring different IT ecosystems through that process. Fragmentation also through facilities or specific departments that are driving IT purchases versus having a system-wide approach to that has introduced other challenges. Modularization of imaging solutions, where some people are experimenting in best-of-breed or deconstructed architectured solutions, where they try to build their own dream solution using best-of-breed products on the market. And what this has caused, the impacts of this is it has caused significant IT burden because you have a lot of redundancy in your enterprise. All of these combined result in a complex environment, and there are multiple systems that require data synchronization, multiple systems that are different in terms of scalability, lots of duplication of administration of user accounts and data, and at the end of the value chain, there are multiple viewing systems, not just diagnostic image viewing, but other viewing systems in the enterprise for other types of information, and that's introducing clinical variance and poor coordination of imaging and care in between facilities and across the health system. So not only operational inefficiencies, but downstream and impact to clinical productivity and patient outcomes. All of these systems at some level have to talk to each other or have some level of commonality in the infrastructure. That continues to grow in terms of challenges. In the end, providers are challenged to bring on and serve both new clinical and technology opportunities. And we see impacts from revenue leakage. And trying to secure this landscape from a cybersecurity perspective is extremely hard. Some old systems were never meant to handle the load of performance while operating and connecting with other departmental systems. They begin to run into design challenges with the overall system scalability and struggle to handle the converged data. Overall, in many health systems, medical imaging data has become a liability, and we believe that having a solid enterprise imaging strategy in place can help turn that around and turn your data into an asset. So what are the customers and the industry saying? Based on our industry research and working with our partners, the number one problem we see the C-suite trying to solve today is containing cost. This has been at the top of mind for CIOs for both in 2018 and also for 2019, and that's cost control and expense reduction. It is their burning issue, trying to squeeze costs out of IT in any way possible. And this is really important as there are many changes in the way finances are being run in healthcare facilities today, and they're looking for new technologies to help them achieve new savings. The second one is complexity. They're trying to reduce complexity and risk. Their bucket of problems is overflowing, and with different organizations, they have different priorities. In one organization, it could be cybersecurity concerns that have bubbled up in their priority. In another, it could be disaster recovery and high availability. Overall, it becomes complicated to manage the information. Requirements continue to grow, and they find it difficult to manage. And at the same time, they've had a hard time trying to find trained staff to be able to meet those requirements, whether they're existing and new requirements coming on. And thirdly, outcomes. Data is perceived as an asset, but in reality, it becomes a liability. It costs money to manage data, it's expensive to upgrade, to store it, it's expensive to migrate from one storage technology to another, and it doesn't generate any revenue. So CIOs are looking for ways to convert their data to be an asset, and how could it generate better outcomes and perhaps revenue rather than just the data sitting there and not very useful. So organizations are trying to achieve better outcomes, but information and systems need to support the enterprise and those desired outcomes. Again, enterprise imaging is the reason why healthcare organizations are adopting enterprise imaging strategies, and the reason why it has become so predominant in the marketplace is that we can have a direct impact and improve costs. Holistic enterprise imaging strategy. Let's have a look at what a system-wide enterprise imaging strategy looks like. Typically, an enterprise imaging architecture strategy encompasses these components, which is fairly uniform in the industry today. It starts with an archive, often the foundation that can manage and secure and store all of your imaging across imaging specialties. This is also where you would build your analytics and some of your artificial intelligence and population health initiatives off of. Then you have a set of workflow and acquisition services for each of the imaging specialties. We all know that cardiology and radiology are the most significant digital imaging specialties in medical imaging today, but it is much more than that now in the enterprise imaging world. There are other specialties such as point-of-care ultrasound, you have medical photography, which is applied to dermatology, nursing, surgical, and wound care also have video and endoscopy solutions, which are also applied to surgical and other clinical care settings. Finally, pathology is the next upcoming digital medical format that everyone is talking about in the industry today. And what we see is by consolidating all of these imaging specialties down to a single system, the aggregation and sharing of images to a single point of access is that you can achieve economies of scale by centralizing your IT resources down, so you have less redundancy in archive system by breaking down these silos. But we also see clinical improvements as we roll further up the chain here in this enterprise imaging stack. Based on our experience, workflow orchestration engines are also crucially important, have a very high return on investment for the benefits, the quality programs that they bring. These are systems that allow you to coordinate the clinical care team in a tight, synchronized way. As synchronizing healthcare is very complicated, there's a lot of different clinical staff involved in any given care team. And this is where workflow orchestration engine has been proven to not only promote good care team collaboration, but impact outcomes such as patient length of stay and improving clinical outcomes by making sure that the broader care team is made aware of urgent results or secondary findings in a closed loop fashion, and most importantly, that it's done in an automated way. And finally, enterprise imaging strategy is about building a more comprehensive health record. The universal viewer, the enterprise viewer, is the window into the electronic health record. This is a critically important piece that supports the care team. All those individuals interacting with the patient, whether they're physicians, clinical specialists, surgeons, rehabilitation specialists, nurses, etc., though many have focused on the radiologist and cardiologist experience, and they're definitely very important stakeholders in the whole value chain of imaging, but where in the industry that has lacked focus is in building a compelling experience for the primary care team. You need to make sure you have the right enterprise viewer that is designed specifically for your care team, giving primary care teams easier and more secure access to the patient's entire imaging, presenting a whole patient story view across diagnostics and other clinical imaging, improving their clinical confidence and making them more efficient. So when you add both using the internal look at imaging data and the external look at the data which is within the electronic health record, all of this about the patient, both of these put together result in new clinical insights. Especially in the value-based healthcare of enabling the care team, you're providing them a mechanism to give the users new insights about their patients they're about to make clinical decisions and treatments for. So enterprise imaging is an important pillar of the EHR strategy in the same way that electronic health record is aggregating all pertinent information across all clinical and diagnostic service lines, so too does enterprise imaging from an imaging perspective. And where are healthcare organizations investing in imaging today? Radiology and cardiology are by far the biggest imaging specialties in health systems today, and we do see most investments today happening in radiology and cardiology consolidation. Consolidation is really what's driving these from an enterprise imaging perspective down to a single IT system. And the reason is because these are the biggest and heaviest IT-intensive imaging systems out there. And there's a lot of opportunity through consolidation to improve the IT operations, such as uptime and high availability and disaster recovery. We talked about how difficult it is to secure and provide high availability in a number of IT ecosystems versus one IT ecosystem. Examples like reducing vendor management, improving IT labor utilization, and then there is clinical workflow optimization, which is easier when you have a consistent technology stack driving workflow across your IDN. It's about aggregating the management of all of those images and optimizing the workflow. Having a single solution across your health system for consistency to reduce clinical variance and improve workflow and reduce IT burden will go a long way to improving your imaging operations. We're not going to spend a lot of time going deep into radiology and cardiology today. These are pretty well-known specialties. What we want to talk and explore more about is the clinical care team experience, the broader imaging that is being used in the health system, and discuss how technology is evolving to better improve outcomes of health systems for this specific care team. As I mentioned, enterprise imaging is much more than just radiology and cardiology imaging. Imaging is much bigger than those, and here's a list of departments that we have identified through our partners that produce images of some kind. And that's whether it is endoscopy or medical photography, ophthalmology, point of care ultrasound, burn unit. All of these departments produce images. And there's much more imaging that occurs within health systems than many people realize. Many aren't aware of how many departments are creating images across their enterprise today. And again, you have to imagine that this creates complications. These are probably largely departmentally driven solutions, and that they have their own way to store, manage, and archive that data, which probably, again, causes some compliance problems. Probably causes more IT redundancy, but it also creates more islands of information that are not accessible to the care team or aren't accessible to future artificial intelligence algorithms for utilization. The data is locked up, and it is challenging to progress on valuable clinical capabilities and opportunities. So we see a lot of value in aggregating this information. We know images are valuable within the care cycle, but this data needs to be unlocked from these silos to do anything meaningful with it to better enable the care team. So this is the scope of data, and you need to think about physician experience today and their obvious dissatisfaction and productivity impacts. Continuing to throw more data at them is not going to help things. We have to find ways to provide a meaningful clinical experience for them that allows them to efficiently consume imaging data and results for clinical decision and treatment planning. Outside of radiology and cardiology and building from the last slide, here's an example of 3 types of medical imaging that are quite commonly used in most health systems today and have a big impact on healthcare and provider performance. First being medical photography. It is quite ubiquitous use in health systems today, whether you know it or not. Physicians are quite often taking photos with their phones or other devices, and that's a challenge. And often these photos are taken with unsecured devices, and we've seen examples where physicians have been texting these images amongst each other, which is unsecure, and there's a potential for information to leak out of your health system. So imagine if a physician loses that device. Losing a device is the #1 way that patient information is leaked outside of your health system today, and that is a significant liability. Additionally, how does the care team get access to those images if you have to share them point-to-point, one-on-one, and it's not very effective? So we know that having access to medical photography can impact patient outcomes. Things look very different in a picture than they do from the imaging, and this helps from a whole patient understanding. Dermatology serial follow-ups for melanoma, a photo description together alongside radiology imaging may change the opinion of their findings. Documenting pressure ulcers with photos on admission and being able to have them automatically display alongside radiology imaging for primary interpretation may actually change their diagnosis and outcomes. So there are lots of examples for nursing and wound care where these are being used on a daily basis, and these images are very effective in supporting the diagnostic decisions and recommended treatments. And in the end of the day, it helps the entire care team provide better patient care. The key, and we will talk more about this, is smart presentation of this data for clinical consumption in the coming slides. The next one important to highlight is the point-of-care ultrasound. The challenge of point-of-care ultrasound today is that it is encounter-based capture. And again, in many healthcare systems, these have become ubiquitous. Point-of-care ultrasound is often referred to as the new stethoscope, the new diagnostic tool that frontline physicians are using to quickly try to isolate a problem in a patient, and because they are encounter-based, they may not go through an EMR workflow to order that exam because it takes too much time. An efficient encounter-based capture is essential. If you're not capturing those today, it means that you're missing out on potential revenue, and that can lead also to compliance issues. So we see many health systems investing in this today just to close off the compliance-related issues. Lastly, there is surgical and endoscopy solutions for capturing surgical video and surgical photographs, which again help to complete the electronic health record, helps to reduce disparate data pools because many times surgical wards are maintaining their own IT solutions to capture these images, creating yet another data island and resulting in redundant storage and infrastructure again. The ability to aggregate that down will help the broader care team and reduce some more of that IT infrastructure and cost. So in summary, a system-wide enterprise approach can help you improve your compliance, improve your operations, and capture more billing and improve care team collaboration. We want you to consider for an enterprise imaging strategies how you can use it to help build a more comprehensive healthcare record. You can see on the left-hand side all your traditional electronic health records, and on the right-hand side is the imaging side of things, and really these two things should be combined as one to support the care team. One of the essentials of an image-enabled electronic health record is to have integrated an enterprise viewer that is available to all care team members to improve better consumption of data and images, easier access to images, but provide effective screening and diagnostic results, and promote collaboration among the entire enterprise in a way that it is most effective for them. So let's explore more about the concept of building a more comprehensive health record and building on that struggle that care teams have today in finding information and having a meaningful clinical experience. So when we talk about enterprise imaging and how it should be designed for the primary care team, what do we really mean? So first, let's talk about some of the challenges they face and what we see today in the market. We've spent a lot of time collaborating with care team members in every medical discipline to understand their unique challenges and how they interact with the EHR. These are the common struggles that we see them experiencing today. Number one, majority of the clinical care team members spend so much time on their feet. They're always on the move, whether they're doing rounds, they're at a patient bedside, they're looking for a meaningful experience that gives them fast access to images and results at the point of care on their devices and from anywhere. The second big challenge they have is the imaging viewer experience is too technical and complex for them to easily interact and navigate and consume clinical data. Often they are provided with a viewer that is merely an extension of a radiology or cardiology diagnostic viewer, and it isn't designed through a deep understanding of their clinical workflow and problems of each of the care team. So a nurse practitioner would interact with images and patient information differently from an image-centric orthopedic surgeon that would need to do 3D reconstructions as a guide for surgery, or an internal medicine physician, for example, who needs to understand the whole story of a patient whose abdominals have undergone different types of imaging and has had more than 30 studies over time. What is most important in terms of access and presentation of images, for example, for a pulmonologist that is on the move and needs to deliver personalized care and communication to a small child's family in the exam room, is also different. So it is important, if you're researching an enterprise viewer, ensure that it is designed through a clear understanding of the practice patterns of the different care team members through an understanding of their unique needs and workflows throughout the enterprise. A simple user interface where they can easily glean clinical insights from imaging data and reports leads to improved productivity and patient outcomes, as well as increasing the physician satisfaction. And we all know that's been a challenge. Through our experience and physician feedback, while it is important to capture images and be able to display them in the results, figuring out the best way to display the information has been a challenge for many solution providers in the market. And when you start to add the growing number of studies by patient, especially at large IDNs and tertiary care centers, individual exam sizes are growing, and patient imaging is coming from multiple sources, including bringing on imaging across multiple service lines. You have your wound care, medical photography, dermatology, and so forth. And healthcare consolidation as well, that is acquiring new sites, that's also introducing more patient data. So with this explosion in accessible imaging and large amounts of data to have to mine through, for this reason, access and consumption of data becomes increasingly important to be factored into design of any enterprise viewer solution to drive physician productivity and clinical and patient outcomes. Physicians are very busy, they're multitasking, they don't have much time to explore data, and the presentation of imaging and results must be optimized based on the care team member. And this is key, and this is something you need to look for when you're choosing an enterprise viewer. Collaboration, this is also another challenge there, and there's also very different types of collaboration. It could mean different things. It could mean image sharing or their workflow intelligence and ability to communicate critical results and secondary findings. So the care team challenges we observed centered around communication of results and secondary findings, receiving critical findings from imaging in a timely manner, and the need for enhancing their connections and collaborations leading to more informed and connected care across the enterprise isn't quite there yet. Other collaboration challenges, for example, radiology may be somewhere in the basement in the hospital, healthcare facility, radiation therapy and oncology in another area of the facility, emergency room has its own location, and it's about the whole care team and how can they be enabled to efficiently center around imaging and collaborate in a virtual environment to discuss complex cases or interesting cases in real time. This is another problem for them. One other point that I didn't mention here is access to data is more than about image access of data from multiple data sources, but the data being optimized through the environment that the clinical care team must operate under is also important. Often, the enterprise viewers through an EMR have not been optimized, for example, through a Citrix environment, through a BDI environment, and the design may not have been factored into how enterprise viewers are used on tablets throughout these environments. And at the end of the day, the care team is frustrated with interoperability and connecting to devices ultimately impacting patient care. So we outlined a few of the struggles primary care and clinical specialists within the care community struggle with today, and we hinted at what an effective experience should look like for them and how it should be designed for them. So more about what their imaging experience looks like today, the core traits. These are the core capabilities that enterprise viewers have to have, and you'll see that most in the market claim they have that today. So to touch on just a few, zero footprint. Most can do this. This is not unique anymore. Be able to connect to multiple data sources as well. Most can do it. But things you need to look out for here is some tend to have performance connectivity challenges, retrieving data from disparate systems and efficiently aggregating that data for display. Viewer tool set, most have them. However, the approach has been a single mega viewer approach, and this is something you need to look for when you're searching for a viewer, because having a single mega viewer approach impacts the experience and efficiency of the intended users, and we'll talk more about that in the coming slides. We talked about the value of an enterprise viewer is when it is enabled to an EHR, and it is an essential requirement today for physicians to access their entire medical library no matter where they are. While all of these traits are commodity components and serve essentially serve as the baseline for an enterprise viewer, it is not sufficient. An enterprise viewer to be effective for the primary care team needs to be much more than these. So we see the next generation of enterprise viewers are going to be very different from what we've seen in the past. In the past, they had been merely extensions of radiology and cardiology, and a result has been very technical imaging experiences and really didn't factor in or consider the intended users being the primary care team throughout the enterprise. What we see in the next generation viewers and what they're going to do better is that they will be specifically designed for the care team. They'll be optimized for data consumption and have more effective multi-imaging experience. That includes optimization of image delivery when they say connect to multiple data sources or connecting to multiple archives. And the aggregation of data for display will factor in things like body parts and clinical conditions and disease. For example, if I am a neurophysician, I need the ability to blend a patient's CT exam of the orbitals with the ophthalmology images and at the same time have the structured report all optimized in the same view for clinical decision making. On the device side, they're going to be optimized for a mobile device because we know these patients are always on the go and there is an increasing need to connect to any device and users wanting to be on the golf course using imaging. We hear this a lot. Allow me to be able to access imaging when I'm on the golf course. From the surgery room, ICU physicians want to use it with different devices from anywhere for patient consultations. It'll be very easy to deploy. They're expected to be very easily to be deployed and roll out and run on very low-end devices if needed as well. Mobile solutions will be more than a lift and shift of a desktop version of an enterprise viewer to mobile, but rather designed specifically for the diverse clinical users in the care team for mobile device interaction. Gesture technology will be well thought out and implemented. Browser support optimizes. This has been a challenge for most solution providers. And I think the other big thing is designed such that it's designed fully to understand the screen layout, including navigation and tools desired by these users. Then we know there's going to be also a big transformation towards cloud going forward. This is where technologies such as hybrid rendering are going to help performance of these systems and be able to quickly display results to these physicians. We look for enterprise viewers today, and if you're looking for them and researching them, you want to look that they support on-premise version of hybrid rendering, giving the clinical team users the best performance experience. Hybrid rendering allows the system to optimize the server and user devices, and it dynamically evaluates each user's device for whether it has the necessary hardware to perform image processing functions and thereby offloading these tasks from the server. Historically, the market relied on server-side processing to display and reconstruct medical image data sets, and that still applies, but server-side rendering is not best for all clinical scenarios. New methods such as hybrid rendering is where you'll start to see new adoption. When we talk about cloud computing, this is a very important concept as well because of the ways cloud computing improves performance is by giving you enormous access to compute in the cloud infrastructure. There are solutions in the market today that offer these capabilities, so when you're researching your solution of choice, these are traits that you want to be thinking about. So let's explore a little bit more about next generation. So a quick recap, what we see emerging today in the next generation enterprise viewers is a big focus on design for the primary care and clinical specialists, and that's going to be complemented by high performance and flexible access. And most importantly, in this era of large data and accessible imaging, intelligent presentation of all imaging specialties, including other ologies that can provide actionable insights and improve their outcomes, is going to be key. So we talk about imaging's ability to impact your value-based healthcare transformation. This is an example of how that can be achieved. These viewers are designed for how physicians and general care team members interact with imaging, understanding that they may not be technical imaging users, but they're going to be able to interact and consume results in order to be efficient for them. So let's look at some examples how we've seen imaging experience done for the clinical care team, some of the clinical challenges we observe with them and how they can be resolved. We observed this with hospitalists, internists, nurse practitioners, and others, that I've got under a minute and I need to review the imaging report and a few key images. Today, I'm unable to view images and key results side by side, and when a report is called up, it overlaps the image and I lose my clinical reference. Having to switch between prior patient exams and pulling up reports is a big mess. Efficiency is lost through trying to match dates with study exams and reports. It's really a big mess. So what is this our team members looking for is all the data that they need at a glance. Make it easy for me. Put everything in one place and that it is simple. Blend the report together with the images, and even better, have it synchronized such that when I select a prior exam on a different date, the report and results dynamically update as well. Design implementations such as this example improve their focus and clinical productivity and overall time savings. Ensure that you are looking for these types of traits when you're selecting a viewer for your care team. And as pediatricians, oncologists, and others described here, some from also this previous slide, these specialists are dealing with a large amount of patient data, and there is a challenge. How can I efficiently navigate through my complex patient studies that have anywhere between 35 to 200 or more historical priors? How can I focus my search on the subspecialty studies that are critical for this patient's care? And we know that the patient has very complicated imaging histories, and the enterprise viewer must be able to give body part or condition-centric views to provide a quick synopsis. And here's a screenshot where the design provides a whole patient story, a rapid look at the whole longitudinal history of that patient. And the ability to track key images of a pediatric patient with a pneumothorax in the ICU for clinical decision-making and treatment plan improves the overall experience and patient outcomes. And also if you look at, for example, an emergency room physician that is about to discharge a patient with multiple imaging completed and having the ability from a tablet device to communicate a whole story view summary of the issues and possible treatment planning with the patient and the patient's family improves both the physician and the patient experiences. This type of design saves them the penalty clicks to have to sift through large amounts of data and to line everything up. This is all available at their fingertips. Similar example as it relates to large amounts of data. As many patients have many types of imaging exams and a long history over many types of pathologies and injuries, again, it can make it very difficult for a physician to get through that information. Traditionally, a care team member would have to sift through all of this imaging. Instead, now the next generation viewers are going to be smart and be able to allow you to organize results around a condition or disease or body part. And it's about driving more information about the images themselves. In this case, you will see in this example, the patient has 250 studies, but what is presented is the brain bleed cases. This way, the neurosurgeons can focus and easily navigate on the patient's bleed story view, and all other imaging and non-relevant body parts is filtered out. Even more so, they can review the daily CT scans to check if the brain bleed has decreased overnight without any interaction. In traumatic brain centers or stroke centers, there could be a dozen patients to be checked in daily. They're getting checked in throughout the day. Having a smart presentation tailored to the needs of the neurosurgeon makes comparing key slices to the relevant study faster and easier. Again, they have a way to show a patient's whole imaging story during rounds with their resident and discussions with the patient and their families optimized on their mobile device of choice as well. Through a couple of examples of how the next generation enterprise viewers will be able to improve the experience for certain types of physicians, but there are many more examples. As different types of physicians interact with imaging in different ways. There are a few more examples on here. I won't go through all of them, but if you want to explore these more and if you have questions about these, please feel free to contact us on that. Over the course of the presentation, we explored overall what an enterprise imaging strategy looks like today and the different components that are involved, different parts of an enterprise imaging strategy. But what we really are stressing in the presentation today is a specific component of that enterprise imaging strategy, and that's the clinical experience, the clinical care team experience. This is one of the areas where the industry has failed in the past, and that is the fully understanding the unique clinical imaging needs and building a flexible platform that tailors the user experience based on the diverse clinical problems of their primary care team. So now before we bring this presentation to a close, I am going to shift gears and just leave you with another thought, an important aspect of enterprise imaging that we believe is going to transform the industry over the next several years. We won't spend too much time here as there will be upcoming educational presentations focusing specifically on this component of enterprise imaging. And that is cloud. The next big shift that we see in enterprise imaging is the shift to the cloud. Up until now, healthcare providers have been very resistant to cloud for a number of reasons, and they mainly are around performance, security concerns. How are you going to display large data imaging formats like tomosynthesis and PET-CT imaging, you name it. And we've done significant research here, and cloud is a very significant part of the enterprise imaging strategy, and that is what our research has shown. As we've communicated with over 100 CIOs and VPs across the U.S., what we've learned is there is significant adoption of cloud-based IT solutions already in the market today. Many organizations have their EHR in the cloud. So cloud is where the industry is heading, and it's no longer a question anymore. It's a matter of how fast can the industry shift and adopt. The key drivers from most recent surveys and the key factors being considered for moving IT systems to the cloud always comes back to things like data privacy, security, performance, and financials. There are a lot of solution providers in the market today that are talking about cloud, and many are saying that they support cloud. Similar to how they said they support mobile devices on their enterprise viewers, it is important to explore more. Do they really support cloud, and are the applications natively designed to be optimized in the cloud? What we see happening in the market is that solution providers are taking their existing architecture and hosting it in the cloud. And this brings a whole set of on-prem challenges along with them into the cloud that won't go away. And it won't allow them to take the full benefit of cloud computing and deliver on the full value. So we believe, and what we're focusing on, is a cloud-native architecture. An architecture that is built for the cloud will achieve superior outcomes as these solutions have been architected to take advantage of things like cloud computing, performance, optimized for network latency. It's going to be easier to deploy with no need to procure and design project-specific solutions and hardware and additional resources. It'll also be easier to upgrade, another advantage of cloud-native applications. So that is really the focus, is cloud-native architecture. And cloud-native enterprise imaging is really designed for the era of data and artificial intelligence. It will allow smart organization of data for efficient access and consumption in that era of large amounts of data and artificial intelligence. And this is really through unlocking that data and making more use of that data. So next generation enterprise imaging systems must be data-driven, and cloud-native solutions are a critical enabler of that. So I'm not going to go much into detail around some of the other points. What I can share with you is that cloud-native enterprise imaging solutions will transform medical imaging, and if you want to learn more, please reach out to us. I also encourage you to look for and register for upcoming Change Healthcare educational sessions that are focusing specifically on this topic of cloud-native enterprise imaging solutions. So that brings us to the end of the educational session today. And at this time, I will hand the floor back over to Emily to kickstart the question and answer period. Thank you very much for joining today.
Thank you so much, Indra, for that fantastic presentation. We will now begin today's question and answer session. The audience members can submit any questions they have by typing them into the Q&A box you see on your dashboard, and we'll get through as many questions as we have time for. And it looks like we have a number of great questions coming in. The first one from an audience member says, can clinicians use an enterprise viewer from home?
Okay, yes, this question we do get from time to time. So the answer to that is yes. Most enterprise viewers today should support access and viewing from home and on the run. Essentially, if a physician has left the facility and needs to consult or review images on the run, anywhere where there is a Wi-Fi or mobile network, they should have access to the enterprise viewer. And also at the same time, they should be optimized to work over challenging network conditions. So that's something you want to look for. And appropriate security protocols to authenticate valid users and keep data secure in transit should also be something to check in on. For remote access to be effective, whether it's on a desktop, this experience needs to be optimized for multiple devices, including mobile devices. So definitely discuss these options and capabilities with your solution providers and understand the benefits they offer by having also their remote access from the cloud. So those are things that you definitely want to discuss with your solution providers.
Fantastic. Thank you so much for clarifying that. It looks like we have another question that's come in, and this question is, does the enterprise viewer require that DICOM images be transferred to the user's workstation or mobile device? Does the viewer store any patient-protected health information on the user's device?
Okay, so yeah, this is another one that you do want to confirm with your solution provider. And the answer is no, in that it should be standard with most enterprise viewers in the market. You do want to ensure you ask them this question when researching your enterprise viewer solution. No PHI should ever be written to disk on the client device. So a good enterprise viewer will have broad support for healthcare imaging standards, enabling interoperability with essentially a broad spectrum of applications.
Great, that was super helpful, Indra. And then it looks like we just have time for one more question today. So the last question we have here is, what kind of image sources can the enterprise viewer get data from? Can the viewer connect to multiple data sources?
Yes, so that's another great question. Yes, most enterprise viewers in the market should enable users to access imaging results stored from multiple data sources, such as a PACS system or a vendor-neutral archive, a VNA, and any departmental storage systems.
it is important in this situation that you're now also accessing a lot more data, which could overwhelm users if it's not presented intelligently. So it's best to ensure the solutions you're evaluating can demonstrate smart presentation of this large amount of data that is now accessible, and to make sure that it is simple and easy to consume by the care team that are going to be the most affected by it.
Great. Thank you so much for that informative response. And it looks like that is all the time that we have for today. So I wanted to thank Indra and for her excellent presentation, and to Change Healthcare for sponsoring today's webinar. We hope that you enjoy the rest of your day, and we look forward to having you join us for future webinars.